Okay, so the session that I will be introducing is called Test and Implement. So we are looking at both testing and implementation activities. We'll mostly first focus on the testing activities. Okay, so you've already went through the other parts of the software lifecycle development cycle. We did I think the design and develop yesterday, and today we'll be focusing on the test, which is this one here, the test and implement. As I mentioned, we will be trying to explain the template that is used for test and implement, share some experiencing that we have experienced within the field, and also the company, JMB as a company, some of the experiences we've had, and also learn how to move to the next phase of the project management. So the first one we are starting with is the testing. Is the testing part. We will most focus on the user testing. So we are looking at usability testing and user acceptance testing. For usability testing, the first one that we'll look at, so there are some different stages of usability testing. The first one that we'll look at is heuristic evaluation. So with heuristic evaluation, the software development team, it can be your designers of the developers, will use the heuristic checklist to evaluate whether their software is usable or not. So in this case, the software is not yet developed. We're using the prototype or the design templates to evaluate whether the software will be usable or not. So this helps even before the software is developed to make sure that we don't develop something which will not be usable for users. The checklist has more items on it, but the most use are 10 items, which I use for the heuristic checklist. So this one, as I mentioned, happens in the early stages of development before like the software has actually been ready for users to test. The second one is cognitive walkthrough. So with cognitive walkthrough, again, this is a team of experts. It can be your UX designers, your product designers, your product owners, or any experts within the field of software design, where they will take the task which will be performed. So I'll make an example. If we are designing a software that will be used at a clinic facility, there are tasks that are done within the clinical workflow. So those experts will take all those tasks, try to understand how to test the learnability of the software. So we normally use cognitive walkthrough for complex software, software which are not used by many people, to make sure that when we are introducing the software, it will be easy for new users to learn the software. And then the third one is usability study. So in this case, the software has been developed. Now we want the users to evaluate whether it is usable. So they are not evaluating the user requirements. They are just clicking through it to check if it's understandable to them without being trained for using the software. So those are the usability testing techniques that can be used. And then we will jump into user acceptance testing. So the user acceptance testing can be done two ways. It can be done as the software is being developed, or it can be done after it has been developed just before the implementation. So if we are doing it as the software is being developed, we can have, for example, for the development team, for the testers who are testing as part of the development, they can use a QA environment to test the software, to check for bugs and to check that it meets the requirements. Once that passes, then we can deploy the software into a staging environment where the users can start testing to evaluate if the software meets the requirements. So this is testing. This is normally done in an agile environment where users test as part of development. If we want the users to test after the software has been deployed, so the development team, including all the testers, will develop the software fully and then test it internally. Once they're happy, then they will release the software and then make it available for users to test it. So this is done before the software can be deployed in an environment, in a production environment. So the users who wants to use it can test it. Again, this is mostly appropriate when we're working with clinical data to make sure that before the software is used, it is correct. There are no errors, and also there's no misunderstanding of the requirements. So after the user acceptance testing is done, then there will be a formal sign off. It can be, if we are developing it for a facility, it can be the manager of the facility to say, okay, the staff has went through the software and then they're happy with it. Okay, so there are some checklists that need to be, that can help when testing. So this checklist is not a must that you must follow. It can be adapted. People can add theirs or they can remove, but it's just an idea of things that to look at when doing testing. So the first one is to make sure that there is user acceptance criteria. So the user acceptance criteria is taken from the requirements where we understand what the user expect, from the software. So when testing, when designing your test suite and your test cases, it is better to have the user acceptance criteria so that you know what the user is expecting. Also, define the quality assurance plan, where you will plan how you will take care of the quality assurance testing. So this is from the development. This is part of the development now when the software is being tested. So we need to plan for that because we need to understand the people that we need, all the resources that we are going to need. If the software needs to meet any legal or regulatory or standard policies, then we need to document that. We know when we are working with health information systems, they normally like standard that we need to follow. There are policies of each country that we need to follow, things like you have the personal information of the patient. So all those need to be taken into consideration when planning your testing. And also for UAT, user acceptance testing or validation, you need to plan for the key stakeholders that will participate on that and make sure that they are aware of their participation within the UAT, and also they are willing to participate. Because in most cases, the people who are doing the UAT part are the users who could be doing the system, will be using the system. So it's better for them to understand when they will be needed in the testing workflow, and also that they make themselves available for that. Also, there should be a system or a way for people to log issues, bugs, change requests when the system is being developed, and also for when they are doing UAT. So if there's a bug that is reported, it must be visible to everyone who's part of the development process. And also, when planning, there should be test cases that are developed to test each use case. So taking the requirements that were created during the design phase, and then create test cases to test each requirement to make sure that at the end of the day, once the development is done, all the requirements that were issued are being met by the system. And also ensure that there's a plan for user acceptance testing. So you've planned for user acceptance testing. Now make sure that it's the one I mentioned before, that there's a plan to include users, because the user acceptance testing is the one that makes the team which is developing, or the team which is managing the project, it makes them know that the system is ready to go live. And also, if there are there's a governance board, make sure that they approve the testing process to make sure that the software meets the requirements before the system goes live. Tariro, if there are any questions, just watch out for that, and then I will answer them as we're going along. Okay, so the testing phase of the software development lifecycle doesn't happen once the software has been developed. It starts even with the design, with the preparation. We start with the preparation, planning for that. With the design as well, we don't just start developing. The designs need to be tested. That's where I was mentioning that we used the heuristic approach. We use the cognitive evaluation because that's we want to test that the software is appropriate and correct before we even design. Because once we design something which is not correctly done, once we develop something that is not correctly designed, then we are wasting time. So we need to test even before that. And then the designs now will go to development. And then again, once the code has been created, the screens are nicely done, then we test again to make sure that firstly, there are no bugs, and also that the system meets the client's requirements. So the testing part is not only it does not only start once the design and development are done. It starts at the beginning. Yeah. So to test, especially for bigger projects, even for small, I think it's important for the teams to understand that it's better to create test cases. So what test cases do is that you take your requirements and then you break them down into specific test cases so that you can test each requirement separately. This helps to make sure that there's nothing being missed. So within the test case, you can design the test case using any template. You can design it using Excel. You can design it using other test case suites like TestRail. You can use other systems that are appropriate to you. But where money is an issue, you can also use Excel. I will show you a template that we used shortly for Excel. So the test case will include something like a description of what the test case is all about, the resources, the people who will be involved in that, precondition, post-condition, what needs to happen before and after the test case has been done, flow of events. So each requirement, especially, so if, for example, if I'll give an example of a flow of event, you cannot add a patient diagnosis without the patient being created in the system. So that's a flow of events. So the patient needs to be created first, and then they need to visit a facility, and then add an encounter, and then we can diagnose the patient. So that's the flow of events. And then if there are any exclusions or inclusions for the test case, and if there are any special requirements. So again, you can exclude some of these, and then you can add something that will be relevant to you, just as an idea of how this is done. So here is an example of a test case created using Excel. So this is the login screen of an application. In this case, it's OpenMRS. So you will first have, so when designing your test cases, it's better to have like test case ID, so that you will be able to track the test case, and then your test case title, and then the steps which are needed for the test case, the expected results, whether it passes or fails, and then the screenshot. The screenshot helps also to identify if there are any issues with the system, if there's a bug being introduced. It helps to identify a point in time where the case passed. So you will use, if let's say you run your test cases more than 5 times, you will have like different versions of the same test case, but documented in different times. And also it's very important to keep track of that, because there are some changes which are introduced in the systems where we might not know who introduced them. So it's better to have a track of when those changes, when the last test case was run. So I just want to focus on this one, the steps. So during the steps, you need to document each step within the test case that must be done. Like even the one we feel that people will know them. So you need to be clear on that. I see a hand raise. Thanks, Dr. Pinyam. I see someone has a hand raised. You want to ask a question? Okay, we can proceed. Okay, so this is the same example. I won't dwell much on this one. It's the same template, but this one is for creating or searching a patient. So this one we are searching for a patient. It's called finding a patient, and then this one here we are creating the patient. So this one will most likely be done. So the creating will most likely be done when the patient is not found here. And then again, you state the expected requirements, the expected results, because the person who's creating the test cases might not be the same person who is doing the testing. We might have a team of 10 testers who are testing. So we need to document it such that anyone can just follow and start testing. Okay, so that's the test case, and then the testing plan. So with the testing plan, you need to have a schedule of when you are going to run your test cases. So now you already planned your test cases, then you need to plan when you're going to run them, and also the people who are responsible for running the test cases. Okay, so that's the testing part. And then so as we are moving to this test and implement part, we need to go back to update our organization project organization chart, because now we are hiring new people for your testing. You will have your testers, you might have your QA manager, you might have your normal testers, manual testers. If there's automation testing needs to be done, you might have your automation testers, and also planning again for things like implementation. You need to have your implementation consultants and other people who will be involved in that. So you need to go back now to your organization chart to update, first of all, the roles which were there for these new phases, and also the responsibilities within the project, what each role which responsibilities each role will have. So it's very important to always go back when you have new staff or new roles within the project. Okay, and also not only update the roles and responsibilities, but also the communication. So I'm not going to go into details in this because I know that they were covered on earlier sessions, but I just want to give them in the light of this. So update your communication. So for the team, how are they planning the new teams which are being integrated? How are they planning to communicate? Are there going to be any meetings? The frequency, how are they planning? Are there documents that will be created? Where are they going to be stored? All those things need to be included, not just assume that everything will just work automatically. Okay, so before I move to implementation planning, are there any questions regarding the test part?
Yeah, I think the questions will be forwarded at the end of your session. That is the usual way we proceed.
Oh, okay, that's great. Again, if I'm moving a bit quicker, I was looking at the time. I was not sure if I was able to cover everything, but if I'm moving a bit quicker, just let me know so that I can try to slow down. Okay, so we are moving now into the implementation. So we've done the testing. Internally, we are happy that everything is fine. The users have done the UAT, and then we've just received our sign off to say, okay, we can start the implementation. Everything is fine. But before the implementation is done, there's some planning that need to be done by the implementation team. It helps to have a checklist so that you don't forget things and only realize once the implementation is already ongoing that there's something that has been missed. So we have a checklist. Again, this is an example of what can look like. In many cases, you will add more things to this or add more details about this. So one of the things that needs to be looked at for the implementation is the team to develop training plans and materials based on the training. So things like if we are going to do presentations, to create your presentation well in advance. If there will be exercises for those trainings, create like your exercises, and also create your test data or the data that will be dummy data that will be used for training. So it's important to highlight that as well. Also, create a detailed implementation plan. Then that will explain how the software will be deployed, including the training, technical support, and elbow support. Because when you implementing a system, you don't just go there, train, and then go away. There is some also after that those activities are done, we need to plan for support so that the facility or the people who are implementing for are not left to figure things out for themselves. So it's very important, and also help for support for just after the implementation has been done, so that users can be assisted for when they are starting to use the system. And also ensure that sites are ready for implementation. You might find that you are not only working with one site, there are multiple sites. It might be for your region, you might be maybe deploying in 30 facilities. You can't just use one facility, for example. You must go to all of them to ensure that everything is ready. There's the connectivity. If there's network needed, it's installed. If there's internet needed, ensure that it's already there. Hardware and other things which are needed for the implementation side, because you don't want them to start. You don't want to start installing or deploying those once you start the implementation, because something might not go right. So you need to plan to do those in advance, so that when you are implementing everything, you're just focusing on the software part or the training needs of the implementation. Also, check things like security requirements for the software, hardware, and infrastructure are met. So those from the software side will include things like your firewall, your software to scan for viruses, hardware, again, and infrastructure. Make sure things like the server room has logs, or there are some burglary on Windows for the server room and things like that. Make sure the computers and have lock-on keys so that people don't just take them and move away. So there are many security considerations that need to be in place before the implementation is done. And also make sure that there's a clear process to document issues and change requests. Again, same as when the software is being developed, there might be issues which are picked up after the implementation. So the team needs to be able to send those, to document and send those, so that if anything needs to be fixed, it can be fixed. So there should be a process of how that should be done, including a system of where it should be done at, and also prepare things like the documentation. So your user manuals for the users, installation guides, code documentation. So you might find that in some cases especially for open source software, the software is developed, but it can be changed by other organization and then implemented differently. So the documentation for developers needs to be there so that they will be able to use that, and then operating guides for system administrators, and then things like product description for when the software has been done, just to update to highlight the current features of the systems, and also things like release notes, future iterations of the software. Yeah, and things like your detailed disaster recovery and backup plans, because it's very important to not just to deploy a system, but you must you must also take note of the disaster recovery for if something goes wrong. Maybe the server is stolen, or there was fire, or things like that. You need to be able to recover into the state where it was in the quickest possible way. So again, here you might want to consider things like keeping your backups at another location, so that when, let's say, there's a fire, not everything is damaged, then you can still have your backups, and so forth. And then also finalize plans for continued support and maintenance. It's easy to develop software and then deploy it, but most people don't think about the support, especially in the environment that we work in, where we are funded per period. We might not think about those things, but it's very important, because the reason some of the projects fail is because there's no support going into the future, and then staff will leave the organization, and new staff come in, but they're not properly trained, and then the organization will stop using the software. However, if there's support and is documented, and you plan for it, then the continuity can be managed better. Okay, again, here, this is just an idea. Things change, and organizations' situations are different. So you might find there are some more things which are more important to you, then you can just include them in this template. Okay, so once you, as part of the planning for implementation, you need to create a schedule of when things will be done. So starting with things like planning and coordination of meetings, software development, when the hardware will be purchased, because in some of these cases you'll find that if, let's say, there's a specific server that is needed for the deployment, it is not available within the country. It needs to be purchased somewhere. Or if, like, there are some, I've worked on another project in the past for blood safety, where we needed specialized printers to print the donor numbers. So again, you need to plan for those in advance to make sure that they are purchased, and then put the schedule in place. Again, things for user training, develop user manuals. Obviously, you need to develop user manuals even way before the training. Work with the organization to develop SOPs, which are standard operation procedures, to ensure that they define how they want the system to work, and how each process should be. So these are all part of the schedule. So they need to be defined on when each thing will happen, each task will happen within the implementation cycle. As part of the planning for implementation, we need to think about software requirements. So here we are not only talking about the software that we are deploying, we are talking about other components. So your operating system for the server, and for the computers that will be used, your database that will be used, and so for all, depending on other equipment that you are using. If they have software that is not part of the software that we are deploying, those need to be thought of in advance and then documented, so that as part of the planning, they can be purchased or they can be procured at an earlier stage. The same for hardware. We need to think about that. I've already mentioned this, things like servers, your computers, for organizations that do they go out to get data, data collection, things like tablets or smartphones for that, or those devices. So we need to think about that. And also, if you are using again printers, scanners and things like that, you need to consider that in advance. And then other things like the material which are being used. We had an issue with one of the organizations where we're deploying, where the donation identification numbers were not produced locally. Then they had to be purchased in another country, but the process took longer than we planned. So in those cases, that needed to be planned in advance, so that you make the purchase and ensure that the delivery is done before you run out of stock. So those are the things that need to be planned for. And also there's the facilities that are needed for the implementation. So this might not apply to everyone. So for example, when you are doing a bigger implementation, you might need a server room. So a room which is only dedicated for the servers, mainly just for security reasons, and also for continuity, so that no one can just access it and mess up everything. And then you will need a training room, which is dedicated for training. So all the things that, if you are doing hardware assembly, you might need a dedicated space for that. So you need to plan, depending on the type of project you're doing, you need to plan for all the types of tasks you'll be doing, and see if you need dedicated spaces for that. Again, here we're talking about, I think we've already mentioned some of these, but I just want to highlight it as part of the implementation planning materials and documentation. So material you purchase for the initial implementation and also for future needs of the implementation. We don't only focus on now, but for future as well. For the documentation, there will be some documents which are needed just before the implementation, and also there will be documents which are needed for support, and other things that not normally looked at are things like process flow. So if we are introducing a new system and users are not yet familiar with everything, it's nicer to and better to create a process flow to show users this is how everything should be, so that they don't need to consult a 100-page manual to go through everything. They can just have a look at a glance to understand how things are working. Okay, and also so this part is for the implementing organization to look at staff requirements. So now we're not talking about the staff like testers or we are talking about staff which will be needed mainly for training and so forth, and also for the organization which we're implementing for. So we need to take note of that. For example, if we are implementing and training 30 organization as compared to one organization, we need more trainers. So that's things that we need to take care of in advance, and then plan for those people to be trained to deliver the implementation. And also have training plan. So for training plan, like format of the training program, like how you are planning to run the training, topics to be covered based on the software, and time required for the training. Space. So are you going to, like, are you training 10 people? You might just need a boardroom, or are you training 100 people where you are needing like something like a town hall or something, or a big facility. And then you should also have a checklist of things that you need to prepare, so that you are not shocked there, and also plan for before you start doing your training. So do like a training dry run, maybe internally, review the training course evaluation, and then feedback from the trainers. Let's say the initial training, get your feedback so that you can improve the training. And also other consideration are things like the approach for the training. Are you directly doing the training, or are you training other trainers so that they can deliver the training? Or is it an online or in-person training? So some of the things that you need to consider. And others, in some areas, you might want to plan your training so that the training itself does not interrupt the clinical work. So if you are training your nurses or doctors, you train it around so that you don't take them all at once, and then the facility is too close. And also in some cases, it's better to take people outside of their work environment so that they can focus on the training, because if someone is within their environment, you might find that during the training they go out to handle some of their tasks. And then additionally, there are some things that can be looked at as part of the after training. So things like outstanding issues. So when you are implementing a software, there might be issues that arise. So you need to document those, and then document the impact of the software, and also the implementation, verification, and validation. It's important that is done once the implementation has been done. So when doing any software project management implementation, there will be some risks. So we need to prepare for those in advance, and then try to see how we can handle them. There are many ways of trying to plan for risk. You can use risk identification techniques like brainstorming, where um, you said generate ideas, or you can use the Delphi technique, where you ask multiple rounds of questions, and then you get your responses and to see different patterns. And also you can do interviews, and also do root cause analysis. These are some of the techniques, but you can use other methods. But it's an important part of the implementation, to ensure that you identify your risk before they occur, rather than wait for them to occur. And then from there, you can decide how you want to respond to the risk. You can either avoid the risk, or transfer the risk, mitigate or accept the risk. I won't go into details into this. You can read some on this, but just to give you an idea. I see we have a few minutes left. The last session I want to look at is the security planning. So when doing in software implementation, it's important to plan for security. Things that you can look at are things like backup and recovery procedures, access control. So this can be access control to the server room or to the other section of the facility where it has important equipment. Also, ensuring that there's not storing of patient data on laptops or USB sticks, to protect the patient level details. Make sure that people don't download important reports into their personal computers. And also data sharing. Have a policy on ensuring that data for patients or any other thing within is not shared, for example, via emails or things like that. And then trained your staff about confidentiality and data protection. Yeah, so it's also very important to consider when doing an implementation. Yeah, we have 10 minutes for questions. So that's all for my session. Yeah, I will give everyone a chance to ask any questions.
Yeah, thank you so much, Zanti, for sharing your experience beyond the presentation as well. Thank you so much. Maybe there are some questions in the chat box. One of the question was, I'm reading for you.
Okay,
what about? Okay.
Yeah, I can.
Okay.
Now you can ask the questions.
Okay. The question was, what about the troubleshooting procedure? Is it integrated? This is one question from one of the participants. His name is Masala.
Yes. So the troubleshooting will be part of the when you are planning for the support. So what you can do is that as you are working with the software, there are a few things that will be an issue as you are developing. So you can create a guide that will help users, let's say support staff to troubleshoot issues. So let's say users cannot access the software. Then you need to check things like your network. You need to check whether the server is on. You need to check whether is there any firewall that is blocking the access. So those are the things that can be documented depending on the type of software and also the type of implementation that is being done. You can create like a troubleshooting guide, And also, as the software is being implemented in other parts, you will find that you are getting a lot of support maybe for similar things. And based on that, you can create a troubleshooting guide. So a troubleshooting guide is not like a standard thing that can be created like before and then it's final. It can evolve as the implementation is continuing. But yeah, it's something that forms part of the support plan once the implementation is done.
Yeah, great. Thank you so much. That's really helpful. Maybe the other question from Mohammed, is this HIM tool applicable for other projects as well, or specific to this one?
Sorry, can you just repeat that?
Is this HIM, it is an abbreviation actually, HIM.
Yes.
Yeah, applicable for other projects too?
Yes, definitely. It is. And also you can take certain portions, because you might find that your organization does not develop software, but you were tasked to implement software. So the other parts where it's talk about the design and development can be excluded from your planning, and then take the section that maybe focuses on implementation, and then use that portion in your planning. But for me, the tasks which are done within that will almost be similar. Obviously, you will edit, take out few things which are not appropriate for your implementation, and add things which are appropriate for you. However, the template itself is, yeah, I will say it can work in any implementation. Just needs to be adaptable for different kinds of scenarios.
Yeah, thank you so much, Zanti. There is one participant raising his hand. Let me allow him to ask. Please have told, you can unmute yourself and you can ask your question. Yeah.
Thank you, sir. I really appreciate Mr. Kanti for your terrific presentation. My question is, my background is management. So what I would like to ask is, how can we approve baselines for projects like HMS? And what kind of baselines there are, according to different literature, most of them agree there is cost baselines and schedule baselines. According to this your good presentation, what kind of baselines we should prefer? Thank you, sir.
Sorry, I didn't get that quite clearly. Can you just repeat the last part?
Okay. There are many literatures agree that two kind of baselines approving system. Most of them, they agree with cost baselines and schedule baselines. So my question is, according with HMS project management, what kind of baselines we prefer to deploy in our project? Thank you, sir.
Also, between cost and scheduling, I think it is not to do with HMIS. I think it will depend on the type of project, because you might find that in some cases a project needs to be done quicker. So the cost in that in that case is not too much of a factor, but rather than the quickness that the project needs to be implemented. And also in some, you might find that the organization doesn't mind taking longer, as long as they try to restrict their cost, which is being which is being incurred during the project. So I think it favors any. It just depends on the particular project that you are running. These can be applied in any. Again, you can when you see, you'll find that there's a lot of planning within this, and there's also a lot of things that needs to be done. So it doesn't. It looks. It does affect. I would say the scheduling, because if you want to implement all of these correctly, then it takes a lot of time. But I think it's a matter of just finding the balance of what to take out. If let's say if the time is off constraint, you just need to look at what can I live without as part of the implementation, and what are things that I feel like are nice to have within my implementation planning.
Yeah, thank you so much, Santi. Maybe the other question from the chat box was, how can we mitigate security risk in case of open source softwares?
So when you're talking about security risk, are you talking about like people getting access to the software? So I'll just explain like mitigating security risk, but I don't think there's a specific problem with open source software. But I'll just give an example. So for one of the projects that we did, one of the things that we did for security, to implement security, was that the software didn't need to be accessed by people who were outside the organization. So we created a separate network which didn't have access to the internet. So which means everyone who was accessing the software was within the organization. So that's one thing, which means that the data will never be accessible over the internet. The moment you want to access the internet, then you need to log off the private network to access that. So that's one of the few things. But if let's say you're talking about taking a software which was developed by someone else, you can, and if you are trying to implement, you can make use of security aspects just to evaluate, to do penetration testing on the software. If you know that you were never involved in the development, you can make use of penetration testing to check how easy it's for someone to get access to the software, and also use things like the firewall to block access to the server, to manage access to the server. And also, if we are talking about data which will transfer over the internet, you can use things like SSL certificate to make sure that the data is not, even though it's going through the internet, but no one will have access to the data when in transit. So there are many, I think, security measures that can be in place. There's no one size fits all, but I think you need to look at things like, when the data is addressed, it needs to be secured. When the data is being transferred over the internet, it needs to be secured. Yeah, so those are the things that you can look at.
Yeah, thank you. One question in the last minute. As testing can be done at the prototype stage or at the first stage of deployment, when do you think is more preferable from your experience? Yeah.
Both. So remember, when you are testing the design, you are testing. You're not testing like the workflow itself, like the requirements. You are looking at the design itself before it is being developed. So you're not testing like the actual code. You're testing the design itself to say, okay, based on, because the design is based on the requirements. So someone can, if we get requirements, we can interpret them in different ways. We can get the same requirement, but when I'm documenting it on my side, I can document differently, and you can document it differently. So testing it during the design phase, we are trying to make sure that what you designed before it is developed is exactly what the client needed. So it's very important that you test during that phase, because if you don't test that during that phase and then you develop and only show the client that this is what I've developed, and then the client will say, no, this is not what I meant when I say I wanted this. And then you only find out during when the software is being deployed. However, if you do it in the design phase, and then you test it, the client is happy. Then when you are going to development, now you know that, okay, this is what was required. Then you can happily develop and make sure that everyone at least understand the requirements the same. So both types of testing, of all phases of testing are important, but some people find it don't find the time to test during the design, which in many cases they will find problems when they are deploying.
Yeah, thank you, Zanti. Maybe one final question was, do we have a legal background to accuse those people who might share patient data for personal gain? And what did the law say regarding data sharing?
So it depends on each country. So in South Africa, I'm in South Africa at the moment. So in South Africa, I think a few years ago, we introduced a POPI Act, where all companies which have access to personal information of the patient, of everyone, not even patients, of everyone, they need to get a consent to share that data. So if, let's say now, as someone will share my personal details and I will find out who those people are, I can lay a criminal case about that, and then they will need to disclose where they got that information. So for us, there's a legal route where we can take the sharing of personal information. For some countries, there is not. I think you'll need to find within your country borders, but in some there's not. But yeah, if there is, then you can lay a case. And also, even for studies, even the patient details that you have there, you cannot just if, let's say, a specific university wants to do a case of people who are positive, you cannot just share the data without without giving consent to the people who are the holders of the data, which are the patients. So we need to understand who is actually responsible for the data. Is it the government? If the government says, since the data is within our hands, then we are allowed to do whatever we want, then it will be a specific case of the country. But we need to understand that what are the rules regarding the first of all, storing of patient level data, and also sharing. So storing and sharing. So yeah, those are the things you might need to understand, but they differ per country.
Yeah, this is all the questions from the participant. Thank you so much. It was really a nice presentation, discussion pointers. Really, we appreciate. Yeah, cool. Thank you.
Thank you very much, Zee. Thank you everyone for participating, and also for other questions. It's nice to hear the questions, because it shows that you were listening. Yeah. You were not just sitting there in the background. So that I'm thankful on my side as well.
Yeah, thank you. Let us directly move to a session by Colin. Yeah, Colin Pina.
Yes.
Yeah.
Thanks, Colin. Over to you.
Thanks, Kanti. Let me just. See if I can. I'm not able to share my screen. I'm sure if the hostess can give me permission to do that.
Yeah, I think you can make Colin co-host.
Yeah, let me try.
Or allow it to share.
Abby, could you make him co-host, please?
Sorry, I was not really at. Okay.
Thank you.
Right.
Colin,
Thank you. Yeah.
Colin, can you try it? Yeah.
Okay. Thanks, everybody. This is not a long session, so we won't run out of time, and there should be time at the end for any questions. So I'm just going to cover what happens at the end of the process, as you've been covering the last couple of days after some of the development and testing and deployment and into the sort of final product overview and an annual assessment. Right. Okay, so this is where we are now in the section 5, the product overview and annual assessment. I think the one point I wanted to make, just based on the previous sessions that you've had, because some of the questions were relevant to this, is that all of these are shown as iterations. That's the general sort of agile methodology. So as you move through these cycles and whether it's preparation, writing a project charter, you're designing and developing, testing, implementing, etc., is that they are not perfectly linear steps. There are always feedback loops, there are always changes, there are always improvements. And even when you get to the end and you're creating maybe closeout documentation, I think it's important to also take into account that that's not necessarily the end, is that might just be the start of the next phase, and you could be going back into all of these steps in between. And I think it was also relevant to the question around whether you do every one of these steps. Not necessarily. Again, that depends on where you are and what your role is as a business. And I think these are just guides to help you select the best aspects that are relevant to what you're implementing. Okay. Right, so from a final product overview, this is by no means exhaustive. We're now at the end of the development cycle, testing cycle, and the aim is to make sure that we've got a checklist as a minimal viable product, you could say, that's outlines the main aspects that we want that's available. This is not all that's there. You could use others, you might use less, but you certainly could use a lot more. And I think at the bare minimum, there's going to be some form of software documentation, especially for end users. Some of your end users may have been involved in the testing cycles, but most would not have been, and over time they become further away from that phase. And the better the documentation for the end user, the fewer requests you'll get for support at the end of the day. So This is an aspect that's quite an important one, probably the one that developers themselves least like to engage in, but you'll find the benefits far outweigh any of the cons. So as part of that, we've got the end user manual, installation guides for implementers, documentation for developers. Documentation for developers could sit within the code repository. It doesn't have to be in here. These don't all have to be in one document. I'll show just now that they could be part of different cycles. And operations guides for systems administrators, along with product descriptions and opportunities for future iterations. An area that Kanti covered is backups and recovery. This is probably one of the most important aspects in our lives. And I think that starts from the very first time you write a piece of code, whether you've got version controls, whether you're doing physical backups, daily backups, weekly, monthly, annually. This is just a checklist that covers part of that to make sure that you consider it. And again, finalizing, how are you going to support and maintain the solution? Not all of these will end up being the same company or the same people that did the development, so the better the documentation is in that respect, the better the long-term outcomes are. I'm also going to cover the annual operations assessment checklist. This again is, it can be annually, it can be, you could set shorter time periods depending what it is you're doing. But again, as part of the whole iterative cycle that we talk about within Agile, in that even fairly static software delivery type solutions, it's still important to go back and review them. And I think this applies to any type of product. It's not necessarily just a software solution product. Is that I think it's important to reflect on the product, make sure that your processes and procedures are all in place, implementing, the plans are being implemented, they still make sense to what it is you're delivering, and maybe you need to change some of the operational tools or staffing setups, and it's a general review to see how that's going, as well as monitoring the system use and making sure that you've got a clear system in which to document change requests, bug requests, could just be customer support, and a process to escalate these, because sometimes a simple customer support query could turn out to be a major flaw within the system that needs to be escalated through to senior developers. So this is just, I guess you could call this a minimal checklist. I think you develop your own as you went through whatever solution it is you're running with, but it gives you a good indication of some of the bare necessities that are required as we start to roll out any software solution. This is just the table of contents of what we are talking about. So moving into the final product description. So there are a couple of ways of doing this. You could do a standalone document and have all of these in one document that outlines what the system is. I think it's useful to have some minimal documentation that's a product overview, but it also could just be an outline as to where all the other documentation is stored. For example, if everything within your planning and development cycles and testing cycles, if the documentation relating to those are kept up to date. And they might be in particular repositories. For example, your code lives in a particular repository. It might be associated with documentation in that repository. Your testing plan might live with, you might have documentation around your testing plan. So this could really just be linking to all of those particular pieces, or it could be a standalone component that says this is everything that we do. And then this is the one place where we update. I think the main takeaway point from that, though, is that wherever that is stored, it is maintained. There's nothing worse than coming along 2 years later and what you're seeing as a developer is not related to what's documented there. And then we just, sorry, let me just go back. This is also just got a section there of the recommended next steps. I'll cover that just now, but this is the one aspect that relates to the iterations that we speak about a lot. Those next steps could be, we developed a minimum product to be able to get it to a release. We recommend that in order to strengthen it, we need to do these 5 things. This is our future roadmap. As part of that, we might need to increase the hardware. We might need to spend 3 months developing. It could be, we don't know whether this is going to work properly. What is the impact 3 months down the line? So it's essentially keeping track of all of those different aspects that then come together for recommendations as to what do we need to do when we go into the next steps of this. So there you can see it sort of it flows through. It's described linearly here, going through the project development into the system in production, but it doesn't end there. It goes straight back into now I'm outlining what those next steps are. This could be part of your weekly, monthly stand-ups. It does not need to be your documentation that's done quarterly, annually. This is literally something that needs to be as agile as you can possibly make it. There will always be barriers and there will always be long-term planning, and there'll be combinations of different types of methodologies in your development processes. But if you have feedback loops through the users coming back into what your recommendations are, and you can then react to different funding opportunities that come along. For example, you might be on a particular course with a piece of software and there's something that arrives that gives you the opportunity to further develop the software, taking it into a different direction. Then it's useful to have all of these documented as you go, so that you can almost keep versions live as to how this grows from being a small idea into something bigger and larger, instead of trying to do one whole big project up front. So just some of the specific points in there. Some of the features, very often when people release a first version, it has minimal features. It has maybe a specific requirement to satisfy a small group of users, with the knowledge that once that is developed and deployed, then the next steps could be to build on that without having to create a long backlog. People would have heard previously of like waterfall methodologies in development, that where the planning cycle could be 6 months to 9 months, and a development cycle 1 year to 3 years. And by the time a very large piece of software was deployed, it's exactly what was asked for, but not what anyone wants. And that's one of the reasons for trying to be as flexible as possible and as accurate as you can be in what it is you're documenting, so that you can react to what the users are feeding back to you in that moment. You can then plan maybe the hardware that was spec'd originally is not sufficient. Maybe the software is using too much memory. So is that a hardware problem, or is it a code problem? Do we need to go and reinvestigate and send it back into the development team to look into potential memory leaks? Or is it just we've put a very big, heavy piece of code onto a small machine? And then that's where your monitoring will come in to help you with some of that. Again, that allows you to scale it out. So you can go from, say, 5 users to 10 users to 20 companies. And as part of that, you're making assumptions, like what are the activities needed? How many operations people do we need? What sort of maintenance is required? Whether that's hardware, software, what sort of skills are required. Obviously, the more complex it gets, then the different levels of skills you require. Now, do you need to have developers on call, or do we have to have DevOps teams, or can this just be run by average system administrators? And then again, as long as you're maintaining these applications appropriately, if an opportunity arises from a different funding source to reuse or to repurpose or to branch off into a different direction, then at least half of your planning is already done. And so I think this is quite an important step. But again, it can all be compartmentalized into all of the previous steps of the whole development, testing, planning phases of any solution. So just moving on to an annual assessment checklist. This, I think at the minimum, we're talking annual. I think some people will do this more regularly. Some people might not do this at all. But I think as a team, you generally need to be reassessing the project, whether it's from it could just be a sunset to sunrise type check where you know that the validity of the solution is only going to last 3 years and you start to phase it out. Or it could be that, hang on, we've actually got something here that's not being as efficient as it could be. Let's start to document, what the past year has looked like. Have we had lots of outages? Can the efficiency be improved? And this is then very much the place where you start to bring in your stakeholders. So that could be users, it could be testers, it could be developers, it could be anybody that has some form of stake in the use of the product. And although I'd like to say that a lot of this should be an ongoing trend. It's great if you can get live feedback. It's not always possible, and sometimes you have to send out customer surveys. But hopefully some of your monitoring tools will also help with some of these to pick up on usage trends, customer adoption, and things like that. And then there's also other potential benefits. Your efficiencies extend a little bit beyond just efficiencies of the particular project it's involved in. There could be a broader efficiency in the business, in that maybe because of a self-service type option, for example, then there's fewer requests in general going to a support center, and this, and then you're seeing fewer staff required, and then there's a general financial benefit. So there's a lot of intangibles as well as a lot of tangibles, and I think that's where these things are quite useful to measure what you can on an ongoing basis and what you can't on an annual basis. So I think things like your security, availability, reliability, energy usage, those ones at the bottom there, I think those should, as much as possible, have some form of live monitoring, but you could do an annual, much deeper test. For example, in your security, you could do deeper penetration tests to see if there are any vulnerabilities. But on an ongoing basis, you're doing regular security reviews. So again, it's fit for purpose. It depends really what it is you're doing. And again, this is just a guideline. You decide how much you want to invest in this aspect, and how little or how much you do. But I do think that even if it's just a prompt at the end of the year, to say, let's go through these 5 to 10 steps, then at least at the very minimum, you're bringing any potential issues to mind before they become any real surprises. So this is just expanding on what I was saying earlier. There are lots of different prompts you can add into a user assessment. This could be part of a much broader marketing assessment. It could be part of a specific targeted software assessment. But the engagement with your customers, I think, is quite important. And the more you can do on that front, the more reliable your future product will be, the easier it will be to know what changes you need to make, and the quicker you'll be able to react if you do need to make changes. And I think that the closer you stay to those users and customers, then the easier it is to be able to maneuver and react and change as markets demand, or as technologies change, or people's requests change. Not everybody knows what it is they're asking for up front. Very rarely do we see that, actually. In most times, what gets delivered is different to what is originally asked for. And so this is where you're always tracking these. And then as part of this assessment, I think quite a key one, again, as much as possible, have these performance goals as part of your ongoing measurables. But you could do more specific annual measures where you're looking at a previous year, comparing it to company performance. Could be fiscal, it could be technical, it could be something like you've had a huge demand on your customer support. Try and figure out why that is. And then, so if you're collecting some of this information and if it's in sort of reasonably easy to interpret tables and forms, then you should be able to pick up on trends quite easily. Same goes for financial performance. There was a question around cost versus scheduling earlier. That's a fine balancing act that every technology company faces on a daily basis. It's not a linear equation. For example, to bring a 9-month project down to 3 months, it might not be just a 300% increase in staff. It might be a 500% increase in staff. So measuring the impact on costs is quite important, because that could be anything, especially in the current days of cloud-based costs. It doesn't take much for somebody to turn on an instance that quickly grows and generating a fairly significant cost to the business. And if that's not closely tracked, then it will lead to some fairly upset people in the finance area of the business. And then also you're looking for how effective is your product, and does it really make sense to continue? There may come a point where you're actually developing something that you believe has a real impact, but it's just not financially viable. And that's where you need to do these type of analyses as well. So part of your processes includes having people around that can do budget reviews and understand the impact of different costs in the business, and track development time, and what the maintenance cost would be and things like that. So it's just something to bear in mind, because it's not always that well understood when people start a project. And then the next one is innovation. So what other innovation opportunities are there? Customers change. Maybe customers don't change, but markets change, and you see a gap, and there's an opportunity to innovate. Keeping these documented, even if they're not all doable, then it at least allows you to refer to them and go back to them at a later point and say, well, okay, out of those 5, we could do 2. And the other 3 are on the back burner if opportunities arise. And then it also allows you to stay a little bit more in touch with changes in markets, technology, and anything like that as they evolve. So I think having some sort of outlook that's focused on new initiatives, could be simple, could be just modifications. It might just be basic tweaks just to keep things in line with advancements over time. We all know the cycles in technology are very short, but it often doesn't take an awful lot to adapt and adopt new ways, processes, procedures, technologies. Sometimes it's fairly easy. Sometimes it's a case of it's not going to happen at all. But at least if you're tracking it, then and you're coming up with ideas, then it may lead to other opportunities that you're not even thinking of. Okay, and then the overall enterprise architecture. So quite an important one as companies grow, or if you're in especially regulated areas, is you'll have a much broader enterprise architecture. You need to be describing how your current investment aligns with that architecture. You know, and then that information includes the current as is, but also taking into account future architecture. The enterprise architects have got a 3-year plan to completely change the way everything runs. Your systems need to be able to adopt and adapt to that. So part of this is evaluating what you're doing against that architecture and saying, does it fit within? Does it support it? If it doesn't support it, what are the obstacles? And making sure those are covered. You might be developing a fantastic product, but it doesn't fit within the enterprise architecture, and then all of a sudden there's no way for it to be integrated properly into the overall scheme of things. And you know, so again, there's on an ongoing basis, and all of these, although this is annual, on an ongoing basis, there needs to be some form of understanding of these are the roadmaps. These are the bare minimum principles that we're operating against. We know we need to interoperate with these types of technologies, and any system I'm involved with, we need to be able to make sure that it fits within those parameters. Okay, and then security and privacy. That's quite topical at the moment. Kanti mentioned the Protection of Personal Information Act we have in South Africa. There are various different flavors of that in different countries. A lot of countries align themselves to the European Union's GDPR, and will in general have some form of Data Privacy Act. And if they don't have a specific act, it will in general be implied in various other acts, whether it's in a particular health policy or a particular policy around criminal acts. There will generally be some form of privacy protection. And those are areas that we always need to make sure we're aware of. You know, you can't be sharing confidential information, and you know, that's quite a key area for us, especially in the health sector. It's not something that you ever want to end up being on the end of a breach. So it's important to understand what these issues are up front, but not just up front. It's important to understand how they evolve, how your technology supports those. Can you change? Can you modify your security? Are you doing regular checks? And how will you react to anything that does happen? The sort of remediation policies are almost as important as any type of protection that you might do, because the quicker you can react and the stronger your policies are around how you react, then the better the outcome will be if there is any unfortunate incident that does occur. So then once you've gone through all of these and you've done your assessments, assuming this is a formal assessment, then you'd want to provide some overall recommendations. This is I think this is a natural product life cycle. Again, as I said earlier, these are not necessarily linear. This is something that should be an ongoing part of your product life cycle. Is that all software has a sunrise and sunset. At some point, you are going to say it's no longer going to be needed, or it's going to be unrecognizable to what it was in the past. So as you go along, you're making recommendations that saying, yes, this is working well for us. We feel we should be investing more time, more money into expanding it, or we should be investing sufficient amount of time just to maintain it for the next 2 to 3 years, or it needs to be discussed at a IT review board as to whether we continue or discontinue the product in its entirety. So this is where you're trying to balance all of the relevant aspects from a technical, a customer, a financial, a security, all of the policies you've come across, all of the principles you've developed, probably one of the most important summaries for because the people that you'll be sending this to, they will not necessarily be going through and reading all of the other documentation. They'll probably only in general be reading these reviews and the executive summaries. So this is where being clear, concise, accurate as you can is quite important, and honest as you can. We all have our favorite pieces of or favorite tools, but at some point they're a burden to the business, and we may need just to cut our losses. Remember, it can sometimes be more expensive to continue to develop than just to end a project midway and just say, well, we made a mistake, we made a loss, let's move on. So this is just what I was explaining now. You're basing these recommendations on the sort of governance processes for wherever you're operating, and hopefully that aligns with your particular region, your particular structures, and then it's standardized across the board and everybody's doing the same thing. I think the one of the big builds here is that you want to continue to see continued investments. You want to see the modernization, you want to see the enhancements, but you don't want to crowd out other innovations that might come through. So I think it's quite important to be open and honest about where we are with every project and these recommendations. And that's all I've got for now.
Yeah, thank you. You have done, Colin?
I think I'm done, yes.
Yes, thank you so much. Thank you so much. There are a few questions from the books. Can I read for you, or you'll read it? Which one is better?
You can read. I'm just looking for the Q&A. I need to
question and answer.
Yeah. Okay, can you just read the questions to me? I can't pull the Q&A up on my...
Okay, maybe let me start from the last one, and I will go up. How can agile methodologies be effectively applied to align the product overview of health information system with the findings of an annual operation assessment to ensure continuous improvement?
So I think there's room for both. An agile methodology, the original definition of agile meant without process. It's been adopted to include processes, but the iterations are important, and I think you build those iterations in naturally into your support and development life cycles and your product life cycles. Now, your product life cycle could be a naturally evolving one in that on an ongoing basis, you're evolving and iterating, and those life cycles are continuous, or they could be they could have a bit more structure to it, where you do reviews and then you go back into you may only do quarterly or half yearly or annual reviews on things and go back into them. So I think they both have a role. I think the annual assessment is quite important, in that even if you are continuously iterating, it's a good checkpoint to sit back and review on a broader perspective and say, we are continuously iterating at the product design testing level, but we're only going to be able to get customer reviews formally like once a year or twice a year, or we're only going to be able to pull everything together once a year. So the annual assessment might just be a combination of everything you do all throughout the year, or it is just one singular process. But I think it can live side by side with Agile.
Yeah, great. Thank you so much. The other question was, how do we protect our HIS project from malware attacks, and how we assess in annual assessments?
Yeah, malware is a hard one, and that goes into doing everything you can at every step of the way to protect your systems. There are some basic security do's and don'ts as you're developing. There are physical, logical layers that you can separate, and one of the biggest ones, it really is restricting access to only those people that really absolutely have to have access in a sort of controlled, role-based manner. And then combine that with other tools that protect you against malware. So there are tool sets out there that protect against it, and then there are other tools and companies that will help you remediate against attacks if you become attacked. And it's just it's one of those fights that has to be fought on multiple fronts. It has to be fought at the physical access layer with your staff. It has to be fought at the networking layer with your network engineers and networking equipment, as well as your software, how the software is developed. It's an area that requires a lot of coordination. And as we all saw this week, even the biggest security firms in the world get it wrong. So having the very worst case, that disaster recovery backup and disaster recovery plan is at the very least. If you had to do a fresh install, you should always be in a position where you can bring a system up from scratch, but you have to try and protect yourself in multiple different fronts. There is no one size fits all in any deployment.
Yeah, thank you, Colin. The other question, again from one of the participants, most of the time, I think it's a general question, but let me read for you. Most of the time, the software is developed by someone else out of the organization, but they may have access about patient data. How can we control regarding the access that they have?
Well, you should always be controlling or determining those policies. If it's your data that's involved, even if it's an external party that's doing the development, even if they only do development on dummy data, it depends on where the level of confidentiality lies. If if they need to be accessing then the confidential information, then those people need to be trusted as if you are trusting your own employees. And that's where good customer supplier contracts come in place, non-disclosures, things like that. But you've got to be careful about what you expose. You don't have to use live data in any of your development phases, and then that can be restricted to the core group of trusted people. At some point, you have to have some trusted people in this process.
Yeah, thank you, Colin. I think it could be the final question from someone in the chat box. At which stage and how should the issue of interoperability of similar health information systems or softwares be considered in the health sector? It's being a challenge. This is actually a question from Aberra.
Yeah, so interoperability is that's quite a good topic. It's I think that comes back to combination of your enterprise architecture, making sure that that's adaptable and adopts standards-based methodologies that allow for interoperability of different systems. If your architecture only allows for a singular point-to-point interoperability that's not necessarily standards-based, then it becomes difficult to grow and manage. I think the closer you stick to open standards, the better you are. In that, then if technologies change, then as long as the people who maintain those layers that are responsible for the interoperability or the interfaces in the software, then as long as they adapt their interfaces to be standards compliant, then the interoperability problem is a little easier to solve. It's not an easy task though.
Yeah. Thank you.
Sorry,
Okay.
Zara, may I add on this? I think this is really important question, and thank you, Collins, for addressing the question very well. I just would like to supplement on that, to ensure interoperability in the healthcare system. So governance is really very important. So we need to have policy and also standards, existing standards, so that every digital systems can talk to each other. So whenever we develop system, we consider the standards, and then the systems can be able to exchange data. So having a policy and also standards is really very useful. Just to mention, in Ethiopia, we have electronic health record standards, which is developed at the national level. So that means whenever health facilities are interested to implement electronic health record system in their facility, then they need to obey or fulfill the minimum standard, so that probably at a later stage, if there is a need to have data exchange across the hierarchy, a facility, district, region, so it will be easier. So we need to have standards and policy to ensure that interoperability is in place in the healthcare system. Thank you, Aberra, for bringing this issue here. Yeah, over, Zelala.
Yeah, thank you so much, Dr. Tesfaw. The other question, maybe related to the previous one, can agile methodology be used for a large scale projects? How can I mitigate data linkage while coordinating and aligning data across various teams and levels. This is someone from, I think, from abroad. Yeah.
Yes, so software development methodologies, the term agile can be used loosely or quite tightly, and there are different ways of being agile. What is generally used in most principles is it's focused around small teams delivering small subsets of work. So if you think of a large project, then breaking that project down into its smaller components then allows for smaller teams over periods of, say, 2 to 6 weeks, depending on the type of methodology you're using, to be able to focus on those specific deliverables and bring it all together. I mean, agile is not a be all and end all. It's just describes a way of working in that people tend to find that it's easier to operate at that level with smaller groups of people over shorter periods of time, so that they can do more regular reviews and change direction quicker. That's the general principle behind it. It does not mean that it's a combination of agile and, say, a waterfall process of planning an 18-month project. It is not a great way to do it, because sometimes you want that longer term planning, but you might want shorter cycles in between. So you can combine different methodologies as you see fit. I hope that helps.
Yeah, thank you so much. Very helpful. Maybe Shaggao, you'd like to ask online. Yeah, you can proceed to your question. Shaggao? Shaggao? Okay. Any other question from the participants? Any other question? Yeah, let me invite Habtold. Please unmute yourself and you can proceed to your question.
Thank you, sir. I really appreciate your effort to uncover this very, very interesting topic. My second question on this topic regarding how can agile principle be leveraged?
Your voice is a little bit low. Can you be loud?
No, sir. Can you hear me now?
Yes, of course, please.
Yeah, thank you. Thank you very much, coordinator and the instructors for uncovering us this question regarding which this topic is. How can agile principle be leveraged to ensure the annual operation assessment finding directly inform the evaluation of each health information systems product roadmap? Yesterday we have discussed product roadmap. And my background is management. So this is my question, sir. Thank you very much.
Maybe Colin, did you get his question?
I'm not sure I got all of it. I think it was around how can agile inform the product roadmap and the annual assessments. Does that sound about right?
Yeah, can I ask? Okay, how can agile principle, okay, be leveraged to ensure annual operation assessment finding, okay, directly inform the evaluation of health information product roadmap? Because there is feedback loop should be. So agile is a continuous development, continuous learning. So
Right.
how can we leverage agile principle, agile project management development assessment finding directly inform our evaluation of HIS
Okay.
product roadmap. Yesterday we have discussed about product roadmap.
Right.
Thank you.
So,
Thank you, sir.
Okay, I think I get it. So your agile process does not necessarily mean that everything is short term, but it does just mean that it's a continuous iteration. And as part of the feedback that you're getting, your annual assessment is just one checkpoint. It's basically, you could say it's maybe a statutory checkpoint. You know, maybe you're forcing yourself to do that once a year. But it does not mean that you can do smaller versions of feeding that information back into a continuously evolving roadmap. It just means that at that annual point, you're collating all of that information and saying, this is where we are, this is what we've managed to do, and this is where we're going. It's not intended to break the process. It's there as a checkpoint along the way that says we are doing this on an ongoing basis. We are continuously iterating. We might not be changing massive things in one go, but we might be changing small things. And this is how the roadmap has evolved over the past year. And then at that annual assessment, you're now documenting this is how we see it evolving over the next year, even though you will still have iterations during that next year. For me, it just gives you that point in time that says, let's try and collate all of these things and make sure that we're covering all of the aspects in a singular process, but it doesn't interfere with the work that the agile processes are having on an ongoing basis.
Yeah, I think this is all the questions from the participant. Really, thank you so much, Colin. It was an interesting session. So maybe if there are any concluding remarks from you or from Zanti.
Yeah, just from my perspective, you know, thanks very much for the opportunity. I know it's only one small component, but I think it's useful for us to get these types of questions as well, to make us think about what we do in our daily lives as well. So yeah, thank you for the opportunity. It's been good.
Yeah, thank you so much. Thank you so much.
Thank you so much, Collins. Thank you, the GMB team. Really, this is really very supportive. Starting from, you know, the course creation, and also you know, funding the Health Information System Project Management to be a CPD course here in Ethiopia. So your contribution was really very useful, and I also thank you, you know, for taking your time and also delivering this useful session to the participants. I really appreciate on behalf of the University of Gondar. Our partnership is really becoming excelling from time to time. Saying this, for all the participants, we'll have a final session for tomorrow at 2 p.m. East Africa time. So it will gonna be short, like we may not take like more than 1 hour. So, but we'll have further discussion pointers and a reflection from the participants about, you know, the entire online course and how it can be improved further. So we would like to hear from you. Please try to join us tomorrow as usual. Thank you so much, Zelalem, also for the wonderful coordination. Over.
Yeah, thank you so much. Thank you all. Thank you all. Yeah, see you.
Thank you, everyone.
Thank you. Bye.